Well, hello, everybody. This is Dr. Tasha, and I am back with Dr. Tasha After Dark. We are studio bound again. Okay, guys. This topic I really want to kind of discuss in detail just to kind of settle people's spirit. I've gotten a bunch of questions about this, so let's get into it. Today's topic is I want a baby, but one of us has herpes. What do I do about that? How do we handle that? Where do we go from here? Okay, so hopefully you've all seen my herpes video. If you have not, please spin the block. I wish I could say I knew how to link it. I don't know how to do all that stuff. So just kind of go back and watch the herpes video so that you can understand the fundamentals of herpes itself, right? But just to give you a little bit of background, herpes is a contact thing, and I'm talking genital herpes. It is a contact. So it is not about intercourse. I have virgins who have herpes, I have others who do not. So it is about contact, genital to genital contact. When your genitals that may have semen or vaginal fluid or whatever touches the genitals of the other person and somebody's having a herpes outbreak or somebody is shedding or somebody just generally has herpes and those genitals connect and that fluid gets from one person to the next, bam, we got some issues, right? So the question becomes, okay, but I told my partner I have herpes, my partner told me, whatever the case may be, and what we want to have a baby. And how do I address that? Well, first and foremost, the transmission rate of herpes is only 5%. And it says only 5, right? But 5 is not 0. And just like somebody gave it to you, you can pass it along, okay? So it's like, well, what do we do? How do we prevent? And there's no real 100% way to 100% prevent it. People's, well, I know that I have it. Okay, what about the people who don't know they have it? Like I said, 90% of, 80, excuse me, 80% of African Americans over the age of 40 are positive for herpes. So what about the people whose doctors did not check? What about the people who refuse to get checked when they go? What about the people who don't go to the doctors at all? Males have outbreaks a lot of times on the inside of their penis. So don't assume because you haven't seen anything, you don't have anything. Okay. So I don't want somehow people who have been diagnosed with herpes to somehow feel like they're at higher risk because a lot of people out here who just don't know. It's not that they don't have it, they just don't know that they have it. Okay. So um one thing that I want to be clear about is the only thing you can do is one, be honest. And obviously, if you're having a baby with somebody, 9 times out of 10, they know that you have herpes. You've probably shared that if you're looking to have a baby with somebody. If not, out of respect, and only if you know their status. Because, like I said, one of my biggest things is people are always like, oh, full disclosure, but y'all are willing to disclose, but y'all are not willing to ask for any information, which actually drives me bananas. Okay. Um, so one of the biggest things is making sure you guys are on the same page as far as diagnoses, who has what, blah, blah, blah. Right. So you have to be honest about what you have going on now. Let's say you're somebody who does not get a lot of outbreaks. I say, well, what's a lot of outbreaks? Acceptable amount of outbreaks is 1 to 2 outbreaks per year. Okay. If you're having more than 1 to 2 outbreaks per year, what I usually do for my patients, I'll treat in 3 month spurts at a time. So let's say you're like, yeah, doc, I had a couple of outbreaks within a particular time period. Okay. I'm usually going to, obviously, it's 2 pills a day for 5 days. And then what I usually will do is keep you 1 pill a day every day for 3 months. Okay, just to get the viral load down, just to suppress the viral load. And what I will start to encourage you to do is pay attention to your immune system. Okay, that means get rest, drink water, get some physical activity, limit your sugars, limit your processed foods and your carbs. Make sure you're taking multivitamins. If you're looking to have a baby, you should be on prenatal vitamins 6 months before you're looking to get pregnant. And if you want all the information, go to my website, drtasharogers.com. If you don't already know, I wrote a survival guide. It's called a survival guide for Black women. Um what I call it, a survival guide for Black women for labor, pregnancy, labor, and delivery. I'm sorry. So it is on my website, drtasharogers.com. That is where it's for sale. You can get a digital copy, you can get a hard copy. Okay. But I take you through everything from trying to get pregnant to when you're pregnant, to what questions to ask the doctors, what tests to get at what weeks, what clinical diagnosis and clinical conditions and medical conditions to know about, to finally getting to the hospital, what to do, what not to do, what to say, what not to say, pediatrician information, the whole 9 yards is in that survival guide. So if you want more information, go to drtasharogers.com, and you can get the survival guide. Otherwise, when it comes to, as far as trying to protect, like I said, you want to make sure not that you tighten up your immune system because it's a virus. And the stronger your immune system is, the lower the viral strength is going to be. So, rest, water, proper hygiene, proper hydration, physical activity, balanced meals, stop with the fast food, stop with the alcohol and the hookah and all of that kind of stuff, which again, you should be stopping anyway and getting to a healthier weight, which again, obesity, increased risk of everything, miscarriage, morbidity and mortality, everything. So we have to be mindful of trying to have a healthy body moving toward that next phase. And again, we want to make sure that we're minimizing our outbreaks. Now, I'm not somebody who feels like, oh, you have herpes. So what you need to have, you need to be attached to Valtrex at the ankle like a shackle for the remainder of your life. No, 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 ma'am. I don't know. No, get somebody else to do it. That is not true. Okay. But until we get your outbreaks under control, I will do 3 months. And if you're like, yeah, I haven't had an outbreak, doc, okay, well, let's, stop the medication and, just make sure we're again picking up those healthy habits and doing all the things. If you're not having an outbreak, your risk of transmission is only 5%. If you are having an active outbreak, which I never recommend having sex during an active outbreak, one is going to be uncomfortable. Two, you're actively shedding. And so I would say, because your risk is increased to 15% if you're having an active outbreak, but please just don't have sex during that time. Okay. And unfortunately, because it is genital to genital contact and our genitals generally contact each other before actual intercourse, obviously, condoms do not decrease that risk. And how can we get pregnant anyway if we're using a condom? Just putting it out there. Just putting it out there. So, the best thing that you can do, one, be honest with your partner. And if you're with somebody, understand the risk of contracting herpes. It is low, but it is present. And if that's a deal breaker for you, then obviously, likely that's not somebody who you can have a baby with because potentially, and maybe not, you can be with somebody for years and not necessarily contract herpes. But at the same time, you can't be pissed off if you contract herpes because we know that that's the situation. And so, like I said, healthy immune system, do everything you can to remain healthy. Now, a lot of times people will, and this is a fight that I have to fight people with all the time, and I'm tired. I'm tired about to start singing Negro spirituals. I'm tired. Here is how any virus works. Again, you have a viral load. That means how many copies of the virus are in your body at any one particular time, right? And so, when we do things like strengthen our immune system and change what we eat and do a thing and do another thing, when we test, because tests are they're read and interpreted by humans, they're done by computers. Let's say a test is designed and it doesn't pick the virus up until it's this much virus, right? But you've been doing all the things, you've been doing the work, you've been taking, whatever herb you feel like you want to take. I think it's lysine. You guys have been taking the lysine. You've been eating right, drinking water, alkaline water, all the things. And so your immune system is strong as an ox. And so now you have this much virus in your blood, right? So now when you take the test says negative, and you like, I got rid of herpes. I got rid. No, you didn't, sis. You didn't. What had happened was Just like when you have HIV testing and you become undetectable, that is what it means. Does it mean you're free of HIV? It does not. Just like it does not mean you are free of herpes. Once you get a virus, and we can argue this point all we want to, but the science is the science. The anatomy is the anatomy. The physiology be physiologying. Okay. So here's this. Once you have a virus, after 6 weeks, that virus is tattooed on your immune system. It ain't ever going anywhere. It will slide down the range a little bit, a lot, a little bit, a lot, but it will never come off the track. Are y'all hearing me? Now, here's this. I want to debate the point. If it makes you feel good to see a negative test and you can convey a negative test to somebody, but like, here, see, I'm negative. Bull, go off. Do you, whatever is going to soften your heart, your mind, your spirit, whatever is going to make you get through, that's what I want you to do. Because your health is important to me, mental, spiritual, emotional, all of that. But the reality is, gain a little bit of weight, start eating crazy, start going for fast food again, stop getting rest. Go ahead on and whatever it is, be a whole bunch of stressed. Watch what happens. Oh, you're gonna have an outbreak to the herpes that you think you got rid of. And now you want to argue with the next person because you think he done reinfected you. No, or you think she done reinfected. No, that's not how that works. So for all the people who are out here and for these scam accounts who are going to jump in my comments, Dr. So-and-so cured my herpes. Lies. I just block them because I ain't got time. Lies. Now, like I said, yes, viral load can dip down to where the test cannot pick it up, but it doesn't mean that it's not present. Okay. So again, the lower the viral load, just like anything, the better. So my recommendation, if you are trying to get pregnant, also Valtrex once a day. And the reason for that, Valacyclovir, I'm not going to say Valtrex, that's the brand name, Valacyclovir, once a day, because the only thing that the medication does, it does not cure herpes, it does not treat herpes. The only thing that the medication does is it makes it easier. Excuse me, it prevents you from having frequent outbreaks. That's all it does. It prevents you from having frequent outbreaks. So it keeps your outbreaks under control. That's all that it does. And again, the less the outbreaks, the lower the transmission rate. Okay. So that is what we're looking for. That is the best that we can hope for. Okay. And again, understanding that it is something that, your partner contracts. Herpes is skin deep. It ain't a reason you ever gonna go to the ER. You ain't got to report it to every single person. You report it to your gynecologist, because if you get a good gynecologist, they're gonna check for it anyway. And then they're gonna bring you back in as if it's a new finding. And you're like, yeah, I knew. But it's not like you got to report it to your primary if you don't want to. You don't have to report it to every doctor you have, all the things. But even when you do get pregnant, the last 4 weeks of the pregnancy, you have to take the Valacyclovir once a day in order to prevent an outbreak. Because here's this. If you're having an active outbreak, and sometimes people never have one and they don't really know what they feel like. But if you're having an active outbreak when you go into labor, it is definitely acceptable to do a primary C-section for that case, because you do not want that baby exposed. And no, it's not like you're gonna give your baby herpes. What the babies will suffer is something called could suffer, not will, could suffer something called herpetic encephalitis. And that's from them sitting in the birth canal and the active herpes lesion shedding, it goes up into their nose and it bathes their brain. And then they start to have multi-systems failure. And usually around 2 weeks of life, they can be impacted and they can actually lose their life. So for my patients who were diagnosed with herpes, they may have not when I used to deliver, they may or may not have ever had an outbreak. But if the HSV came back positive in their blood, I would always give them the choice. We can proceed for delivery. Let me explain what that entails. We're always going to look for active outbreaks. We're going to put the speculum in. We're going to see what we can find. Whoop, de whoop, doop, whoop. We're going to prevent rupturing your membranes as long as we can. But at the end of the day, you are allowed to have a primary C-section, an elective primary C-section, because your herpes is positive. More than not actually used to request the primary C-section, just because of the risks. But that is up to you. Certainly, if your obstetrician has not put that in front of you as a possibility, say it to them because it is. It is. And that's pretty much it. But all you can do is have a healthy immune system. Try and decrease anything that is going to tax or alter your immune system. Make sure you're on your prenatal vitamins and all the things 6 weeks, excuse me, 6 months before you're looking to get pregnant. Make sure your vitamin D levels are, y'all know I don't play about that vitamin D. I'm like a Nazi about that vitamin D, baby. Make sure those vitamin D levels are normal and make sure you're on the acyclovir and you have your outbreaks controlled. That is the best that you can do for you and your partner when it comes to trying to prevent herpes when trying to conceive. I hope this answered most of the questions that you guys had. I just wanted to get it out there and just be able to soothe some people's knowledge and understanding of how this thing goes. Herpes can be very confusing, and people put out so much misinformation about it. I try and say as much about it as possible because I know it's so stigmatizing for so many people. So I hope this helped. In the comments, just let me know your thoughts, any questions that you may have. Make sure you subscribe and like so that YouTube knows that you like the vibes here. Okay, you like it down this street. You like this medical moment that we do here. And don't forget to hype the video because why wouldn't you? Why wouldn't you? So, anyway, thank you so much for joining Dr. Tasha After Dark. We appreciate you. Thank you for watching, and I'll see you on the next episode.